Hello, my name is Dr. Renee Hunter, and if you're watching this, you probably already know that because you're one of our beloved patients. I have some very important information that I want to share with a number of patients in the practice. So to save the time of explaining these concepts 70 times, I just decided to attempt a great job at explaining it once, and then I thought to share the video. So today we're going to discuss one of the main reasons why people come to our office for care, and that is the topic of pain. In particular, since we have a practice that offers chiropractic, physical medicine, and massage, we attract a lot of adults with musculoskeletal pain or pain that affects the muscles, ligaments, and tendons, as well as bones. Let's face it, our office stays very busy because well over 100 million Americans live with chronic unresolved pain. Back in 2011, the pain management cost the U.S. an approximate $635 billion in treatment and lost productivity. Yet if you ask the average pain sufferer what causes pain, you'll hear general responses like arthritis or inflammation, which are terms people tend to repeat, but I'm most convinced that a lot of people don't really understand. The question is, how can you fix something when you don't know what the problem is? So the other day, I asked my fabulous colleague, Dr. Barker, a question. I said, Dr. Barker, I know you have a wife and a son whom you love very much, but if I offered you $1 million to jump out of a plane without a parachute, would you do it? Without thinking for more than a split second, he laughed at me and said, of course not. And I said to him, is that your final answer? And he said, of course it is. And I said, well, Dr. Barker, wouldn't you be disappointed in yourself if I went on to explain that the plane hasn't ran in 10 years and that it's parked on the ground in an open field? And he said, well, of course that changes everything now, doesn't it? So what's the point? Without the proper information, making a poor decision is very easy. In my opinion, even in my young career, I've met hundreds and hundreds of people who suffer quite severely simply because they're missing some of the most important facts about why they hurt. So today I'm going to give you crucial information you need to understand that will help you know maybe why you've been suffering with chronic pain all these years. When most people hear what I'm going to share, they're shocked that they've never been told this before. Just as most people would decline jumping from a plane with no parachute, every day in practice I hear patients say they manage their chronic pain with prescription and over-the-counter drugs. Or they tell me that their doctor says they have arthritis and they've been prescribed anti-inflammatories. Or they say that their joint pain is fine as long as they wake up and they take their first dose of ibuprofen. So for the next few minutes, we're going to discuss the group of drugs referred to as non-steroidal anti-inflammatories. We're talking about the drugs that everyone's familiar with, such as over-the-counter aspirin and ibuprofen, also known by brand names like Motrin, Advil, and Excedrin. There are also numerous prescription varieties. Often, this class of drugs, non-steroidal anti-inflammatories, are called NSAIDs for short. So just to be clear, when I'm talking about NSAIDs over the next couple of minutes, I'm referring to drugs like Motrin, Advil, Excedrin, aspirin, Aleve, Bayer, as well as prescription varieties such as Celebrex, Voltaren, and Anaprox. Every year, more than 70 million NSAID prescriptions are written, and over 30 billion over-the-counter NSAID tablets are sold. I always wonder if a person would feel as comfortable taking those medications each day if they had full disclosure of the possible consequences. What if taking that seemingly harmless dose of Motrin, Aleve, or Advil could mean liver failure, dementia, heart attack, or death? Would patients be more intent on finding the true cause of their pain and working to resolve it? Another problem is that people seem satisfied with accepting that pain is an inevitable part of growing older. They seem to feel the cause is so unknown that resolving it seems impossible. So just in case you surely think that I'm exaggerating potential risks of over-the-counter drugs, let's take a quick peek at the research. One of the most widely recognized and discussed side effects of NSAIDs is gastrointestinal bleeding. According to the New England Journal of Medicine, more than a decade ago, they estimated that on the low end, 16,500 people die from taking over-the-counter painkillers for arthritis alone. If death from the gastrointestinal toxic effects of NSAID drugs was reported separately in the National Vital Statistic Reports, NSAIDs would be the 15th most common cause of death. The European Heart Journal reported in 2006 that for all NSAID drugs, the use was significantly associated with myocardial infarction or heart attack. Even more frightening is that the risk of heart attack appeared after only 1 day of use. Research published in the journal Circulation shows strong evidence that once someone has had one heart attack, they should never take an NSAID drug again, because even taking the medicine for a few days skyrockets the risk of a fatal heart attack. A study conducted at Johns Hopkins University shows that the more acetaminophen or Tylenol you take, the more likely you are to have end-stage renal or kidney disease. For those of you who take Tylenol consistently for about 2.5 years, you have an increased chance of end-stage kidney disease of 780%. End-stage kidney disease leads to death if you do not have continual dialysis or a kidney transplant. The Journal of Neurology tells us that when elderly people who frequently take drugs like Advil, Motrin, Tylenol, that they're 66% more likely to have dementia and 57% more likely to have Alzheimer's. As if gastrointestinal bleeding, kidney disease, heart attack, dementia, and Alzheimer's aren't enough to be concerned about, research also shows that for men, another risk of taking NSAID drugs includes hearing loss and also erectile dysfunction. A large summary was published in the British Medical Journal in 2011 that analyzed findings from 31 different trials. These trials involved over 116,000 patients. The goal is to assess the safety of NSAID drugs. The number one risk again confirmed was heart attack, followed by stroke, death from cardiovascular disease, and then death in general. Ibuprofen, found in Motrin and Advil, caused the highest risk for stroke. Despite all of this bad news about over-the-counter pain meds, just like Dr. Barker's response to my offer to give him $1 million, America's knee-jerk response to pain is to take a non-steroidal anti-inflammatory drug. Now, there is a time and place for medicine, but you should think twice if NSAIDs are your long-term plan for chronic pain. Americans need to learn how to kill the pain without killing themselves. The goal for any health condition should be to eliminate the problem instead of just disguising the problem and causing more harm in the long term. So let's talk about pain. All pain has an actual cause, and all pain, including pain from arthritis, involves chronic inflammation. In fact, the word arthritis literally means inflammation of the joint. It seems all people are familiar with the words inflammation and arthritis, but if you're suffering with chronic pain, I want you to actually understand what those terms mean. While most of us consider inflammation to be a bad thing, the number one thing to understand is that inflammation is a necessary part of the body's response to injury and infection. There are two general phases of acute inflammation: attack and heal. The early stages of inflammation trigger the immune system to protect the body from an injury and to control infection. And the later stages work to regrow damaged tissue and start the wound healing process. Acute inflammation occurs immediately after an injury, and it is usually short-lived, lasting hours to a few days, and it's absolutely crucial for recovery. It's part of the body's natural self-repair process. But the important thing to remember is that inflammation should only last a short period of time until the repairs are complete. Then, ideally, the body generates anti-inflammatory chemicals to stop the inflammatory process. So chronic inflammation is an unhealthy inflammatory overresponse that can linger for months to years. It's like a fire that the body cannot put out. Countless diseases are linked to chronic inflammation, including cancer and many other diseases. So why in the world now are Americans plagued with chronic inflammation? Well, here's one of the most important concepts to understand from our discussion. The chemicals that create inflammation, that your body needs to heal and repair after an injury, are generated by foods that you eat. The anti-inflammatory chemicals that the body produces to stop the inflammation when healing is complete are also constructed from what we eat. And believe it or not, it is the fat in our diet that stocks the body's supply of raw materials to produce either anti-inflammatory or inflammatory chemicals, both of which are critical for good health. In our society, fat is given such a bad name, but the right fats in your diet are absolutely necessary for preventing chronic inflammation and pain. Now remember, we just said that the inflammatory process must take place for your body to heal. So it's critical that the body has the proper building blocks to produce appropriate ratios of both the anti-inflammatory and the inflammatory substances. As it turns out, vegetable oils like corn, soy, canola, cottonseed, sunflower, safflower, and peanut are directly responsible for overloading the body with chemicals that cause pain. These are all classified as omega-6 fats. Keep in mind that vegetable oils only entered American food supply in the early 1900s. Before 1900, American housewives cooked with lard and butter. The increase in the amount of vegetable oils we eat is the single biggest increase in any kind of food nutrient over the course of the 20th century. According to one calculation, we now eat more than 100,000 times more vegetable oils than we did at the beginning of the century. Vegetable oils then were virtually non-existent, but now they make up a significant percent of all calories consumed by the American public. This shift in the American diet away from saturated fat from animal sources and towards consuming fats from vegetables was the result of a theory that animal fats increase cholesterol, leading to the plaquing of arteries and heart disease. And I'm sure that you've heard the warnings about dietary cholesterol. For the past 4 decades, the U.S. government has warned that eating cholesterol-rich foods, such as eggs, would raise LDL cholesterol in your bloodstream and promote heart disease. The problem is that decades worth of research has utterly failed to demonstrate this correlation. Just earlier this year, in 2016, for the first time in 40 years, the Dietary Guidelines Advisory Committee has changed its stance, announcing that cholesterol is not considered a nutrient concern for overconsumption. In the past, the guidelines suggested a limit of only 300 milligrams per day, the equivalent of about 2 eggs. But now, the limit on dietary cholesterol has been removed entirely. This is good news since dietary cholesterol is actually one of the most important molecules in your body. Cholesterol plays an important role in brain health and memory formation, and it's indispensable for the building of cells and the production of stress and sex hormones, as well as vitamin D. Now keep in mind that heart attacks were almost non-existent in 1910 and caused no more than 3,000 deaths per year in 1930. But by 1960, when America had made the switch to vegetable oils, there were at least 500,000 heart attack deaths per year in the U.S. As foods filled with vegetable oils flooded the grocery store shelves, America experienced a skyrocketing incident of the very problem that was supposed to be solved by switching the fat in our diet. Vegetable oil consumption went from an average of 2 pounds per year in 1910 to 25 pounds per year back in 1985. So here we find ourselves in a country where more people seem to have chronic pain than not, and we know that most people have a lifetime history of eating foods that fuel the inflammatory fire. So now you need to know how to supercharge your body with the raw materials needed to produce the chemicals that eliminate inflammation in the body. As it turns out, the missing link in the American diet is the widespread deficiency in pain-killing fats, the omega-3 fatty acids. Omega-3s are essential fats, meaning that we all need them, but they cannot be produced in the body. You have to obtain them through your diet or supplementation. The 2 crucial ones, EPA and DHA, are primarily found in certain fish. ALA, another omega-3 fatty acid, is found in plant sources like nuts and seeds, but must be converted to DHA and EPA, which is not done very efficiently in the human body. The bottom line is that it's fish oil that contains the raw material your body needs to manufacture its own anti-inflammatories. And as simple as that sounds, that fish oil could be a major answer for millions of Americans suffering with chronic pain. I'm not talking about a theory. Fish oil has been shown repeatedly in the scientific literature to be one of the safest, most effective ways to deal with pain and inflammation. For example, the authors of research published in the journal Surgical Neurology first identified that the use of NSAIDs has been associated with extreme complications that we discussed earlier, like gastric ulcers, bleeding, heart attacks, stroke, and death. In this study, after 75 days on fish oil, 59% of patients who had previously taken NSAIDs for chronic spinal pain were able to discontinue their prescription medication, and 88% reported enough satisfaction with their improvement that they continued the fish oil. You can see similar findings in the journal Arthritis Research and Therapy, published in 2006. In fact, those researchers state that fish oil is not only safe, but it's actually more effective at reducing inflammation and pain than the NSAID drugs. The Clinical Journal of Pain published supporting findings in 2010 showing excellent results for patients suffering with various types of pain, including cervical radiculopathy, fibromyalgia, carpal tunnel syndrome, and others. According to the American Academy of Pain Management in 2006, maintaining a proper balance between the various families of dietary fats may be one of the most important preventative measures a person can take to reduce the likelihood of developing one of the chronic diseases of modern civilization, such as diabetes, heart disease, obesity, irritable bowel syndrome, and autoimmune disease. And for patients who may already have had one of those diseases, essential fatty acid testing and therapy has been demonstrated to reduce both morbidity and mortality associated with these diseases. Whereas NSAIDs cause a risk for heart attack, fish oil has been shown to reduce arterial plaquing and the overall risk of heart attack and sudden cardiac death. Research indicates it has far more merit than statin drugs, which reduce cholesterol. There is scientific evidence to suggest that the omega-3 fatty acids found in fish oil can reduce high cholesterol, normalize high blood pressure, prevent heart disease, stroke, cancer, and autoimmune disease, may help diabetes, rheumatoid arthritis, lupus, which is an autoimmune disorder, osteoporosis, depression, ADHD, skin disorders, inflammatory bowel disease, asthma, menstrual pain, and macular degeneration. Research published in the medical journal Pain has shown that the dose of omega-3 fats from fish oil needed for this anti-inflammatory effect is almost 3 grams, which almost makes taking supplements necessary since it's very rare for people to consume this much fish. In fact, the U.S. Department of Agriculture strongly advises against eating more than 1 serving of fish per week for adults, and even less for children and pregnant women, because of the risk of contaminants such as mercury. It has also been shown that the full pain-relieving effect for fish oil to take effect can be between 2 and 3 months. Researchers said that taking supplements for 2 months or less would not likely be beneficial. So if you've been suffering with persistent aches and pains, or if you've been living with arthritis, heart disease, autoimmune disease, inflammatory bowel disease, or any other condition associated with high inflammatory levels, here are the main points to take from my message today. First, vegetable fats, which provide omega-6 fatty acids, supply the body with the raw materials to produce chemicals needed during acute inflammation in the healing process after an injury. Most people are absolutely overloaded due to the significant shift in the type of oils used over the past century. Number 2, when your body fires up the inflammatory process to deal with injury or infection and to start the healing process, this is critical for your recovery. But your body is handicapped without the ability to put out the inflammation when the healing is complete. Stopping the inflammation is not possible if you do not have the raw materials to produce the anti-inflammatory chemicals. Number 3, fish oil is virtually the best source to fuel your body's ability to control chronic inflammation and pain by providing the essential 3 fats, which can only come from your diet. Number 4, if your normal inflammatory process cannot be deactivated, it persists into chronic inflammation, which causes ongoing pain. All chronic degenerative diseases are associated with chronic inflammation. So here are the most important steps you can take. Number 1, get tested to discover your ratio of inflammatory versus anti-inflammatory fats. This is a simple and inexpensive test. Number 2, if you're like 91% of Americans and you're deficient in pain-relieving omega-3s, you will need to start supplementing with high-dose pharmaceutical-grade fish oil. Number 3, be prepared to do an initial trial of at least 3 months and be aware that there is a delay. You might not likely experience any of the results until after the 2nd month of supplementation. Lastly, get rid of the vegetable oils in the diet and replace them with healthy oils such as olive or coconut oil. Capitalize on understanding that your body has the ability to regulate inflammation and pain if you do your job of providing what it needs. Millions of Americans are suffering, and even worse, trying to mask their pain by taking drugs that never solve the problem and can always create additional health problems, even death. It's time that America learn the big, fat truth about pain and end the epidemic of chronic inflammation.